Cataract extraction using phacoemulsification is a routine procedure, but in this particular case, the patient presented with pre-existing central corneal opacity because of the varicella zoster infection during childhood. So here is how the surgery was performed. Patient was made to lie supine on operating table and proparacaine eye drops were instilled topically on cornea. Eye is cleaned externally with iodine and universal eye speculum was then placed. Side port is made with 15-degree lens tip at 3 o'clock position and at 9 o'clock position. Anterior chamber is now filled with balanced salt solution. A trypan blue dye is injected into anterior chamber to stain anterior lens capsule, especially when the view is obscured by corneal opacity. Following 20 seconds, dye is washed using balanced salt solution. Is covered with viscoelastic substance to prevent it from dryness and for enhancing visualization. Viscoelastic substance is also injected into anterior chamber. Using a cystitome made from 26 gauge needle, a continuous curvilinear capsulorhexis is made on anterior lens capsule. In central corneal opacity, it is necessary to make a large capsulorhexis to make use of peripheral clear cornea for easy nucleus manipulation. During capsulorhexis in central corneal opacity patients requires a great skill, precision and experience. Now a superior clear corneal incision is made at 12 o'clock position using 2.8 mm keratome. Hydrodissection was then carried out separating the nucleocortex material from the capsule. Viscoelastic substance was then injected into anterior chamber and on the cornea. Nucleus was rotated within the bag to free it from its adhesions. Using a stop and chop technique, nucleus is phacoemulsified and aspirated. As the view is obscured by pre-existing central corneal opacity, phacoemulsification of the peripheral cortex ensure that the central portion is also phacoemulsified, making use of peripheral clear cornea and thus preventing posterior capsular rent. The nucleus is skillfully chopped, phacoemulsified, and aspirated. It was make sure that the phacoemulsification was done as minimum energy as possible because the cornea is already compromised. The remaining cortex is aspirated by using Simcoe irrigation aspiration cannula. Based on the surgeon's experience, the Simcoe irrigation aspiration cannula is used by oblique movement down to up aspirating while going outside. An AC maintainer was then placed in anterior chamber. A superior clear corneal incision is extended using 5.2 mm extension blade. A rigid polymethyl methacrylate posterior chamber intraocular lens was then placed inside the capsular bag having 5 mm optical diameter. AC maintainer was removed then and the main wound and the side port are sealed by stromal hydration and intracameral antibiotic that is moxifloxacin was given.